everybody. My name is Michael Nacella. I'm here with the podcast number 4 today. And the podcast is dedicated to my brother, Tom Nacella, who was a big part of the Medama program. So, Alex, would you take it away?
And I am in my car in New York City, working. And today we're going to be introducing a very, very interesting company. We have the entire team here from the company, and that is Steve Peltzman, Amanda Phelps, and Sam Koch. And the three of them I've worked with for the past, well, Amanda for the past year, Steve and Sam 2 years, so Steve longer, a couple of years now. And I'm sure everyone is going to ask, what does feedback now have to do with infection control in a hospital? And why do we have them on a podcast that discusses infection control? That's a good question. And that's why I brought these guys on to tell me what it is that they can do to improve infection control or hospital-acquired infections in a hospital. And on that note, I'm going to pass it on to Steve Peltzman first as the president of the company and let him start the conversation. And Mike, you have every right to interrupt and ask questions along the process. This is brand new to you.
Right.
So whatever questions you have, just interrupt. And I'll, of course, interrupt because you need the attention. All right, go ahead.
Thank you, Alex. So what does Feedback Now do? You might be asking. What we do is deploy sensors, physical sensors in physical places like hospitals, also airports and convenience stores. And it's things like, the smiley buttons, like smiley boxes like you see there, that gauge sentiment. It could be the same thing with 1, 2, 3, so patients can request service. I'll talk about that in a second. It's also sensors like people counters, noise sensors, all sorts of things that sense what's going on in real time in physical spaces, and then turn that into operational results, things like alerts. So in our hospitals, for example, we'll put buttons at the patient bedside that say, need help, press 1 for housekeeping, 2 for maintenance, 3 for food service, something like that. So we give the patients the power to, instead of pressing the 911 button at their bed, gives them the power to go straight to those departments and request the help that they need. We also detect like noise in the hospital and help figure out like when noise levels are affecting patient experience, or when a certain number of people have gone into a public restroom, and we compare that with sentiment and help figure out when the proper time is excuse me, to send people. So with that extremely brief explanation, which I did so well on, the answer to your question is something we can discuss in the podcast, but I think it's the first thing that comes to my mind is you've got like the most interested and proactive and ready to help themselves party in every single room, as well as every single restroom and everything like that. And that's the patients and the visitors and their families. They're the ones who are interested in their own, protection, their own cleanliness and stuff like that. And part of what we do is allow them to actually let the staff know when they see cleaning opportunities or, things that need to get done. So I think number one thing it does, and I'll just offer that and roll over to other people, is it gives patients, visitors, staff even the ability to call for a cleaning versus a regularly scheduled cleaning. So if something doesn't look right, they report it, it gets done.
And I just want to interrupt because one of the things that I thought of, and along the lines of what you're talking about, is that hospitals today are cutting. Unfortunately, there are budget cuts going on across healthcare. And as a result of that, hospitals are not being told, okay, you have, especially EVS departments, environmental service departments, are not being told, okay, you're cutting 10% of your workforce, but we don't have to worry about infections anymore. And we don't have to worry about patients' cleanliness in their rooms and in the public restrooms and so on. You're still a hospital. You still have to make sure those patients are healthy. You still have to make sure that infection rates are as low as possible. So how do you do that? And when you're cutting supervisors, frontline staff, managers, and so on, how in the world are you supposed to keep that, level of infection control where it needs to be? How do you improve on it? And with what you just mentioned, that's very powerful because now the patients and the staff and the families of the patients are now participating. I wouldn't say the staff, but the patients and the families of the patients are now participating in keeping your facility clean. So the first thing that comes to mind, and it's kind of funny, is during COVID. I remember I was one of the few people on planes during COVID, and um, and I remember the planes being empty. And the first thing they would hand you when you get on the plane was a hand sanitizer, and you sit there and you would basically wipe down the overbed tables and wipe down the seats. And I was always thinking the planes were never so clean. And in fact, the planes didn't need a cleaning staff to go in and clean because by the time they got on and off the planes, people were wiping down those seats so much that the planes were sterile. So you had actually the customer going ahead and cleaning the airplane for the airplane companies. Delta and United were having their passengers clean the planes. And that was a phenomenal marketing thing. If you think about it, that people were literally cleaning the planes for the airlines. So in a way, by putting these devices in the patient rooms, you're actually making everyone a supervisor. You're making all the patients and the families of the patients unpaid supervisors to manage and make sure that the facility is clean. So that's how I picture it from Delta. So that's what you sort of made me think about in that intro.
Yeah, I
And
love that example, Alex. And Sam, for the podcast listeners, first time caller, long time listener. Um, but it's totally true. And we see that, in our clients where they tell us they're able to save 20, 30% on their labor costs because they're cleaning the areas of the facility that need cleaning based off of the data that they're getting of what parts of the facility are getting trafficked, what parts of this facility are getting really bad scores. And then they can also identify what parts of the facility really need a facelift quickly. So we see it a lot in hospitals where we can identify rather quickly that certain parts of the facility are underperforming from maintenance, from a cleaning perspective, and actually help those hospitals identify with the limited budgets that they do have today, what parts of the facility they actually can upgrade and what parts need it the most. So that data is really actionable both in the moment for the cleaning companies and the EVS teams, but also in the longer term strategizing of how they're going to run the hospital for the next 5, 10 years.
No, it's great. That's really great. Uh, one of the things also, I mentioned this in the past podcast, was the public restrooms. When you go into a public restroom and it looks like Vietnam hit it, whether it's a restaurant, if I was a restaurant, I'd run right outside the restaurant. I know, Mike, you don't care, especially the Chinese places. You just go eat wherever they give you the best deal. But most of us, when we go to the bathroom, I'm just rubbing it to Mike to make sure he's listening. Most of us, when we go to the bathroom, and it looks like Vietnam, we're out of there. And imagine if you're about to go into surgery, and you have an appointment to make in 2 weeks from now, and you walk into the bathroom, and it looks like hell. You're going to think twice. You're going to talk to the doctor and ask him what other facilities does he perform the surgery in. So, I think Feedback Now gives you the ability to keep track of those public restrooms with limited staff. So, I just was in a hospital the other day and they just told me, Alex, we're cutting right and left. We really have a hard time keeping the public restrooms clean. So, Amanda, share with us how the public restroom would be cleaned better with our Feedback Now devices.
Hi, Amanda, for everyone that can't see me. the best value of the devices in the bathrooms is that the alerts go to the staff when someone's having a less than stellar experience, which makes them go and check. We also have devices for the staff to check in when they get there and then to check out when they leave, so they can keep track of how long it's taking their staff to come and resolve the issues, which really cuts down on repeats, which means that more people are seeing the same mess and having a negative experience.
And then how many times, guys, did I don't know about you guys, but I've been in a hospital where I've been in a meeting and someone comes running in and saying, "Boss, the main lobby bathroom, the toilet is overflowing, and the water's now running down into the lobby, and we got to go get equipment to suck that up." Where if you had that flood starting and someone went into that bathroom, like 9 out of 10 people, what they'll do is they'll walk into the bathroom, and if they see water starting to overflow or the toilet stuff, they'll just go to the next bathroom, and then you'll know about it when it's starting to drip down into the basement. Versus if you had the feedback now device, anyone can go running in there, even security or, one of the nurses or doctors press the button, red button, and then we'll know that there's a major problem going on in that bathroom, and we need to get in there and take care of that flood before it becomes a major issue. So again, that from a infection control point of view, you don't want sewage down the hallway. You don't want sewage in the floor. You want that bathroom cleaned and presentable. So I think feedback now, what Amanda just mentioned, is really a great way of getting that thing done.
Yeah, just to interrupt, I was just thinking about, there's a couple things going on. One is whether it's a hospital, a restaurant, airport, or whatever, we pretty much run our operations on schedules. We have staffs, we have schedules. So, a certain number of people that are on staff, and they're scheduled to, this many people from this shift and whatever. And we figured that out over time, because we just figured out, we got surveys results, and we figured, oh, we need this many people to keep up the satisfaction or whatever. And then those people have schedules. They go out and they clean this restroom or this floor or this lobby this many times a day. And those are guesses. Those are bad guesses, inherently bad. I say they're bad guesses because it's a guess. That guess is either, it can't be perfect. So it's either too soon, meaning you're cleaning a restroom, lobby, or whatever before it needed it, or it's too late and you've shown up there after so many people have seen the mess. So we do simple things. It could be the reds that alert you, just like you just described. We also have people counters, so simple battery-powered people counters that we put on the side of a door or on top of the door, and it just figures out how many people are going in and out. And what we do with that is we just correlate. We say, hey, we've got the data from how many people are going in and out of a restroom. We've got the data for how many people are pressing red or yellow. And then we just figure out, hey, for this restroom, on these days, it's 52 people in 85 minutes when things go bad. So you can wait for the reds. You can also just say, hey, instead of waiting for 52 people in 85 minutes for go to bed, I'm going to send them at 45 people in 85 minutes. And therefore, I'm going to stay perfectly ahead of when it needs to be cleaned. And so that again, going back to the labor question that you talked about, perfectly optimizes the labor, but it also perfectly optimizes the experience, and then really stays on top of cleanliness as a whole. So they're driving back to the infection rates.
How
The
are
other
they?
thing that, go ahead, Mike.
I was
Go
just
ahead. I'm
gonna say,
sorry.
how are you educating people on to use this system? Meaning the customers. I go into the bathroom and I see this thing on the wall and it's got these buttons. Now, me, I'm curious. So that's something I don't see in bathrooms. So I'm going to wonder, what is that? Is that what happens? Is there a sign there that tells you what to do with it? Or is there something that tells you in the bathroom
Yep.
that
Yeah.
talks to you?
Yeah. We typically put a sign next to the buttons that say, it asks a simple question. Tell us about the cleanliness of this restroom, right?
Okay.
But we've
That's
seen
pretty big. It
that,
jumps out at you like,
yeah,
tell
and
us
then
what you
really,
think, or
yeah, what, tell us about the cleanliness of this bathroom or whatever. But
okay.
that said, I don't think that's enough. I think if people thought that you were just taking a survey, like, oh, tell us about the cleanliness, and they don't tell you what you're doing with it, people are less likely to press it. We actually work with some behavioral psychologists who said if people understand that they're contributing to an operation, like if they understand, like if you use Waze or something like that, when you drive to get you the right traffic pattern, you can report police. But why would you do that? You're already past the police. Most people do it because they want to be part of a system that ultimately will help them. So if I don't do it, the person ahead of me won't do it and I'll get a ticket. It's the same thing in this environment. If you know that the hospital is using this data to actually scramble people, you're more likely to do it. So we ask our clients, we suggest to our clients, put something on there that says, it could be as simple as your feedback powers our real-time operations. It could be more sophisticated, like, because of your feedback, we've scrambled, 85 people in the last month or something like that. But there is a lot of messaging that could be done that really makes people understand my pushing this button has a direct consequence, and therefore I'm more likely to participate in it.
Now with the patients, for example, it's different. It's not, it's not about the cleanliness of the bathroom. So you have a bunch of different things you would tell them, like if it's, I don't know, if you see things, if you smell something,
There's like an onboarding little document that our clients will give. There's also some of them they just, as part of their, so a patient gets admitted. There was one client who they didn't give him a piece of paper. They just talked to him. They said, look, anything's wrong in this restroom, in this room, you press red, we're coming. And in the case of another client with the 1, 2, 3 button, they
right.
say, hey, they give them a sheet of paper that say, hey, if you have a problem with any type of cleanliness, you press 1, the cleaning team will be there. For the maintenance question, that could be the TV, that could be the heat, that could be, you press 2, we'll come, we'll take care of that. For the food service, you get a meal you don't like, it's cold, press that, we'll come. And the patients, they never even have to press that button. They just are like, oh my God, I'm gonna get this service at a hotel. So when it comes time to do those surveys where they say how attentive were they to your needs, those results pop, and they pop significantly, sometimes 25, 30, 40%.
Now there's somebody connected to those buttons all the time, or they go to a recording, or
They go directly to the department that is relevant, the 3 ones in this case. And, these hospitals make a commitment that they are going to send somebody up within, 5 or 10 minutes.
really?
Yeah, yeah. And they've been asked, well, by other hospitals who are thinking of implementing the system, well, what if the person presses the button, didn't really mean it, just wanted to see what happens?
Yeah, right. See what happens. Sure.
Done. Yeah. And his name is Tim Woodward from Montefiore. He's a real visionary. He basically said, when that happens and when someone comes up and they go, oh, I'm sorry, I must have pressed it by accident, doesn't matter. You created such a moment for them that they tell their friends and they mark it on the survey. So even by not helping them, just by showing up, you created a moment, you created
Plus you're also creating an opportunity to check the room. In other
yeah,
words, why not? If you're getting called in there already, you're walking through the hallways, you're doing rounds in essence to get to that room. So it forces the supervisor and housekeepers to do rounds on those areas. And again, with the limited staff, this is another way of creating a watch tower kind of system, where you're going in there and examining areas when you're just being called falsely, or just, one of the things, I just thought of now, and I'm surprised Sam didn't think about this, is that I'm just giving it back to you, Sam. The other area where infection control might be affected is in a positive way, is that until now, patients without feedback now, when they need their bathroom cleaned, or they need something from a housekeeping point of view taken care of, or dietary or engineering, who do they call? Nursing. Now, nursing has got a million things on their plate. So if you're going ahead and contacting nursing and telling them, hey, I need this room cleaned, or I need I need to get in touch with housekeeping. By the time they do, by the way, it's another opportunity for infections to grow and cross-contamination to occur, because it may take an hour, 45 minutes. Sometimes nursing has a lot more important things to take care of than to call housekeeping. So by having these devices in place, and now you're pressing the number one button, you're directly contacting housekeeping. They can react quicker and take care of that infection control issue. If there's feces in that bathroom or vomit, that's an infection control problem. And every minute that goes by that's not cleaned up, the risk goes up that we're going to have an infection problem. So having direct influence or direct contact with EVS, I think that's something that can be really positive. And to add to that, it now gives the nursing the ability to take care of the patients more. And so on the other side of it, you have an impact, right, Sam?
100%, Alex. And it's like, it is unbelievable the kinds of things that we see with the data on the platform. Just one quick story. We're working with a hospital in Florida, and they, using the system, taking notes of problems that they were seeing, which you can do within the platform. And one EVS member put in, there was a bunch of presses really quickly. They went and responded. There were bloody gauze all over the toilet.
Wow.
And so you can
Crazy.
talk about an infection control problem, like bloody, gauze all over. You're talking vomit, you're talking feces, you're talking a lot of things that can spread diseases really quickly and very vulnerable patient populations. Having the ability to have one less person respond and see that and get close to that is a potentially life or death moment. And so having feedback now is not just an operational efficiency, for sure. It is a tool that can save lives within the hospital.
No,
So
that's great.
So up to have without feedback now, the patient, if it's a patient, has to just ring the nurse's station, right? That's what they do now, right? For no matter what it is. They want a drink, they call the nurse's station. So that's what they do now, right? So now what we're doing is we're splitting the signal. Specifically, they need housekeeping, they need nursing, they need the food.
Housekeeping, maintenance, and food. Yeah.
Okay. So that means you're saying that the hospital then has to commit somebody to answer those lines all the time. So you got a 750 bed hospital, you got to be prepared. Not that 750 people are going to do it, but you got to have somebody available all the time to answer these lines.
Right. Which is a big change management thing, because
I would imagine, because right now I think it's hard to get to those people now without. So then you got to get people's commitments also to buy into it, not just the hospital.
Well,
but
Mike,
also
I would argue the other way around, because think about this, Mike. Let's say you got 1,000 bed hospital, right?
right.
Theoretically, you would need to visit every single one of those rooms every day and make sure, which they do with a housekeeper, to clean that room every single day, right? So let's say each housekeeper does 20 rooms. So you can't just say, okay, we got 1,000 rooms, we're going to hit 300 today, and we'll worry about the other 700 tomorrow. Every day, those rooms got to be cleaned and mopped. The problem you have is after you clean and mop that room, that housekeeper is still on the floor taking care of other things.
Right.
There might be an issue on that floor in one of those rooms that is not being addressed, not being taken care of. And the reason why it's not being taken care of is because that housekeeper has 20 rooms to maintain,
Right.
plus the hallway, plus the nursing station, plus the public restrooms on that floor. So he's not going to go back and check every single room. But if he gets an alert that room 105 has a vomit spill in there, he'll get in there right away and do it and clean it up. And he now doesn't have to worry that, oh my God, the supervisor is going to come by today and take a look at the room and it's a mess. Because he'll know when that room's a mess from the patients who are now, in essence, your supervisor, and letting you know when things are down.
Yeah, as
So
long
you're right.
I understand that. I'm just making sure that there's somebody who's got to answer that phone for that maintenance or for the food or for the nursing.
There definitely is. And if there isn't, then the hospital's in big trouble.
Yeah, and
Because right now,
Yeah,
yeah. I mean, you need to have the wherewithal to maintain your facility. The problem you have is I now had 200 people to maintain the facility, and now I only have 150.
Right.
So,
Yeah.
how do I make that 150 maximize their labor? And if you have these alerts, I don't have to check every single room. I can
Oh,
go
yeah,
to the
no, I think
rooms
it's
when
a
they're
good system.
alerted.
As long as there's somebody
Yeah,
there to answer those calls. If that's what you're doing with without having to leave a message, as long as
correct.
somebody's answering all the time, then I think it's a great system because it's being specific to where the
The,
problem
Right.
is.
the
Maintenance issue.
analogy I use, it's a bit of a stretch, but in 1903, Henry Ford figured out that getting a bunch of people together, building one car, and then starting over at the same bunch of people building another car was how everybody did it. But it's inherently inefficient. And so along came the assembly line manufacturing where people did specific tasks and they produced something like 90% more cars, 90% cheaper. And then everybody had to do it. And so what I was going to say before is it's a bit of a change management process, but this is something that once you do that process, you are operating so much more efficiently and so much better than any other hospital out there. You're doing it with 150 instead of 200, and you're doing it better. And it just takes a little bit of change management and you get to the other side. And we help our clients do that.
Yeah,
yeah,
if you
and
don't change, if you
Sounds
don't
good.
modernize, you can't do more with less. At the end of the day, when you're cutting,
And that
you got
goes
to reinvent the
directly
wheel.
at infection rates because if you're cutting people, then you're letting infections spread. But if you're doing the same work with 150 as 200, you get a handle on it.
Right.
Um,
Exactly.
Another thing that came to mind is I don't know, maybe one of you guys want to talk about it, is the heat maps, because I remember that story about how they looked at the heat map. Do you remember
Where
that?
traffic
Do
goes.
you remember the story, or
Yes.
can you tell it? I'll tell it. So one of the things we generate is, imagine, if you will, every day of the week, every hour of each day, and we kind of get a sense of, is that reddish, yellowish, or greenish based on the presses of, say, public restrooms. And what we showed our clients, specifically this one client, was that they were staffed a certain way. This many people in the morning, this many people in the afternoon, this many people in the evening. And when you looked at each and every day, it started out greenish. Each and every day was kind of the same. Started out green, went yellow, and turned red by the end of the day. Now that either tells you that the day is just a normal thing and the day runs away with you. It could also tell you that there's a perception issue, which is that in the morning, not many people there and whatever. It could also tell you that, like, hey, you've got the same number of people in the morning as you do in the afternoon, yet the afternoon and the evening is when all the usage kind of built up. So what he did is he looked at that and said, well, I need to obviously take the people I have and schedule more of them in the afternoon and the evenings and less in the morning. He did that, made that little change because of the data we provided, and all of a sudden it evened out. So
That's very
even though
cool.
we have, there's all sorts of ways to use this data to make,
It's tracking it. The system tracks it automatically. So
well, this is for people.
you could pinpoint where there's problem areas on a
Exactly.
floor, or could be there's a lot more maintenance issues than whatever's, and
Yep, you got it. And we
and then
know
we
exactly
got a
what
problem patient in one of the rooms, and we know that they're a problem. So because they're hitting the button all the time. So
that. But even
yeah,
with the green, yellow, and red in public restrooms, it's just, you can get a sense of what's going on because we know the exact time and the exact location that every press happens in that hospital.
okay, yeah, it's good. That's a good
Yeah, I
stuff.
mean it's
Hey,
pretty. And also, the other thing that I remember, Steve, that we had talked about was the traffic. So the traffic going in one direction in the building over another, we can now trace where the traffic is moving in a facility. So we have these devices that pick up cell phones and cell phone traffic. So every time a cell phone goes in, and we don't read the data, we don't look at the data that's on the cell phone, unfortunately, unless we really ask hard. No, but we won't. I don't want anyone to think that
Except for
we
you,
do.
Alex. A few of your
Except for
companies.
me. My cell phone, right, which is I'm not hiding anything since yesterday.
Well,
So
it records the traffic automatically, you're saying, or is that
yeah, you can actually detect the cell phone signature. So wherever people come into a facility or whenever people come into a facility, it'll detect their cell phone. So you'll know how many people are coming into your facility, and then it'll actually watch where those people are going. Go ahead, Steve. You tell more about it because
I'll let Sam do this, or Amanda.
go ahead, Sam.
About just tracking what like number of people coming in and when to predict.
And where they're going, right? Where they're going.
Yeah. My favorite example of it is an airport where we're tracking the people as they go through security, and then whether they go towards customs, whether they go or like through the kind of area where all the goods and things to buy is. It's like the shopping center. They go to the restrooms, or they go directly to their gates, um, and kind of loop around away from the kind of purchase area. And so what we find is that the shorter the security line is, the more people go to that browsing and purchase area, then we'll go to directly to their gates or go to the restroom. And that's just more revenue for the terminal operator. And so it's a really interesting game that you can start playing of, hey, what's the correct amount of like wait time that optimizes the patient experience while also, maximizes the amount of my labor optimization and my real time usage of staff and resources.
Well, I would argue also more that in a hospital, if you got 20,000 people walking down one hallway and you got another hallway where people, let's say you have 100 people going down that hallway. So at nighttime, if I was looking at it from an infection control point of view, I'd focus my team on the hallway that has 20,000 people going down, or the floors that have higher, traffic on those floors from the street. I would focus more traffic. So if I'm on in a hospital and right now I'm scrubbing every single floor every single night, and now I just cut my staff by 10%, right? So how do I maximize the staff that I have? I look at the top 5 most trafficked floors, focus most of my teams on those floors, and spend less time on the floors where there's no traffic at all. So now I'm able to control the infection rates in my hospital, even though they just cut my staff by 10%. So these are really creative ways, to save time, save labor,
Yeah, who
while
would
Yeah.
have loved
also
this was
continue to lower
Dad,
rates.
right? Right, Alex?
Huh?
Dad would
Was
have
that?
loved this. My
Oh yeah,
father,
oh yeah. Oh, your father would have gone crazy over this.
especially with what you're
Frank,
talking
yeah,
about now, because you're
yeah,
right. You can deal with your floor situations based on your
yep,
traffic patterns.
exactly,
This is
exactly.
telling you your traffic patterns, right?
Exactly. It's telling you where all the people are going. So using that, and then you can also correlate that with those devices. If you find that certain floors have higher traffic and people are pressing those buttons more often, so you know that there is a direct correlation between traffic and dirt. Speaking of which, let's one of you guys and girls talk about the noise detectors. I think is also a pretty cool thing.
I can take that one. The one of the most interesting things that I've learned in the healthcare space since I've kind of moved into this healthcare role is the effect of noise on healing time. I've seen the studies that loud noises prevent restful sleep, and as well, rounding fatigue helps prevent restful sleep, which makes people take longer to heal. So, being able to measure the noise and control it in the patient rooms will help them get more restful sleep. They will heal faster and be able to turn those rooms over. It is a direct impact on revenue and also related to infection control. They're not going to be as susceptible to catching an illness if they're healing much faster. So I always find that that's such an interesting correlation.
No, that's great. That's a really great point. I mean, the immune system is directly correlated with sleep, right? So if your immune system is up and able to fight off diseases, then it's kind of crazy. Who would think a noise detector would have anything to do with whether fighting off an infection, whether preventing an infection or fighting off an infection that you already have? And the bottom line is sleep, which I still have not figured out how to overcome and sleep. So
Earplugs.
I try. Yeah, well, that's why I'm super careful when it comes to infections, especially on planes. So I'm still wiping down everything with those wipes. I bring my own wipes now, but I'm wiping down the pilot, the stewardess, everyone. I'm wiping down. I'm
So
real
eventually
paranoid.
this system sounds like you'll be able to do something like you'll have probably have like a roommate where you could talk to this thing and it'll just talk back and you could ask it questions. It'll talk to you like a Siri kind of thing. I mean, you could probably build that into it. You're already there, you know? But do you get
Yeah,
reports? You actually have physical reports you can print out? Is that
Absolutely. Yeah,
okay?
100%. Well,
All
our
kinds of
platform
detail,
is
it sounds like.
our platform is a SaaS web-based platform. So, certainly they can be printed out, but most people look at it, by just logging on, and our system allows you to say, I'd like to see all the patient rooms
On the
over the
fourth
last
floor.
12 days on the fourth floor. I'd like to see that compared to noise levels. I'd like to see that, it allows you to kind of correlate, match into all sorts of different things. And it's super powerful in that way. And then, we also don't expect most clients to, it would be great if they logged in every day and they did all that research, but we know that they're very busy doing hospital things. So we also offer the services where, hey, we'll sit down with you once a month, once a quarter, whatever it takes. We'll sit down with you. We'll interpret all the data. We let AI engines go over that, find trends, things like that. And we give you like these really, really, we call it insight services, these really, really intense sort of like reviews of that data that we ourselves prepare and pitch.
Can you guys do any kind of analysis theoretically between, let's say, a hospital has an infection rate on one unit versus another unit, and then correlate that with the amount of times the red buttons were pressed, or when the housekeeping buttons were pressed? That would be an interesting study to see if certain parts of the hospital have higher rates, and coincidentally, the buttons are pressed just as often or more often than other places where the rates are lower. That would be an interesting thing to see whether there's actually the patients and the families of the patients are reporting what we're finding out later on with an infection rate.
Yeah, it's a great question. It's one of those, like, my dream data set that I'm trying to get to. We've done it with HCAPs, and when feedback now is just in the public facing restrooms on a ER floor, 56%, I believe, of the variance of HCAP scores can be explained just with the feedback now data. So you're talking like real-time data shown in the moment that we can tell you where your HCAPs are going to land in 45 days. And that's like a really
Wow.
powerful correlation. So I say that only to say that I have no doubt that correlation is there with our data. It's just getting a hold of it and processing it into something that we're allowed to share. We're still working there with some
We'll
clients.
share that data with Sam. He's ready to do the correlation.
Yeah.
What about speaking of sharing, what about the fact that these days hospitals have such high security, that we're concerned and worried about people breaking in and getting data? So when you start putting these devices in, isn't there a risk that someone's going to break into our system and then get into the healthcare system and figure out what patients' secrets they have? And there's a lot of security these days in hospitals to prevent
Yeah,
these kind of things from happening.
we're in hospitals, we're in airports, and in retailers, all three verticals where security of the data and their networks and everything like that is, the utmost, to say the least, especially with HIPAA and everything like that. And so this system was designed many, many years ago with that in mind. And what I mean by that is we don't ride on, we don't, all these devices, they don't ride on the hospital's network. They don't touch the network. It's basically a private network that we deploy with our own technology that keeps all that data um, out, completely separate from the hospital, and completely private and completely secure. So that, and again, that's a big burden that a lot of solutions have. They go into a hospital and they go, we do this, we do that, we do the other thing. We just need access to your Wi-Fi. We just need access to your network. And there, the vulnerability instantly becomes, no matter how secure they are. With us, though, we're completely separate. We don't even need to talk to anybody. Our stuff plugs in. We use devices that go directly to the cloud. It's all private on our network, and we don't touch anything. Not to mention that the data we're collecting, there's nothing personal about it. It's green, yellow, and red. It's 1, 2, 3. Everything we talked about the people counting and the cell phone, there's nothing personal there at all. So there's nothing to get hijacked or stolen or whatever. It's really just green, yellow. It's the data we've been talking about. So
That's good, Alex.
Very
That
cool.
covers just what you're talking about, right?
Yeah, yeah,
They're
exactly.
covered
Mike,
there.
you're safe. They're not going to find
Yeah.
anything about you.
No, right.
Don't worry, I won't share anything I know about you, Mike. It'll stay between you and me.
Okay. No, I think the system sounds great. They need systems like this. I mean, really, I
yeah,
know
they
how it is.
do.
Well, now going back to when my brother was in the hospital, Alex, they weren't cleaning that room every day, you know? I mean, I should have been pushing buttons. Hey, where's the cleaning people, you know? And I was in intensive care hanging out, and there was nobody cleaning anything.
So much that can be done with healthcare, but there's also so many barriers to it. Like I just talked about the technology one. I've seen some really slick things out there, but now you're bringing in internet connections and you're bringing in all sorts of HIPAA data worries. Like ours, what I like about our solution is it's like the highest impact for the least amount of obtrusiveness or whatever. Like we literally can, you want to do a pilot, we bring in, devices, we stick them on the wall, we plug in our gateways, we're done installing in a couple of hours. And then all of a sudden you're getting real-time data. So there's definitely an element of like in healthcare, there's such promise, there's such potential to bring in all this technology, but there's so many blockers to it. And we've pretty much said, we've eliminated all those blockers and we could just walk in and give you value. So we see ourselves as like a really, really quick way to step into the 21st century it's about time because healthcare needs it.
Well, what was
Oh,
your
this is
background
really
when you came up with this, Steve? I mean, how did you come up with the idea of it? You came up with it, I'm assuming, right?
Oh no.
Oh,
This was
you did.
it started in airports in Switzerland in 2010, I think.
Oh,
Um, and in terms of hospitals, it was not us so much as a visionary guy at a certain hospital who came from, I think, Disney, and he just had an idea about how to change, cleaning in hospitals. And from there, we just sort of next use case, and found visionaries like Tim Woodward, who I mentioned before, who just figured out that this technology was perfect for hospitals. Like we designed it for airports and retailers, but hospitals it was just perfect for, and it's where we're growing fastest right now.
yeah, and Alex, it really helps with communication because that's a big problem.
Yep,
Communication in
yep,
all fields, really, as far as people
100%.
communicating. So this helps with that, really
In
makes
fact, I want to put one in my house so my kids and wife I mean, my dog can reach out to me and let me know what's going on.
A lot of reds, a lot of reds.
A lot of reds, tons of
Are you
reds.
promoting this system, Alex, or are you just working around it? Are you promoting it?
I'm promoting it. Yeah, yeah, yeah. We're pushing this
Good.
in hospitals, and I think it's a really a great. Again, what we try to do is try to find ways of maximizing the labor that's out there, especially now with all the cuts going on, and to not only give you the same results, but give you better results. So this feedback now is definitely one of those companies that we love to put into our tool chest to help our customers do that. So
Sure.
yeah, to answer your question, yeah,
Yeah,
we do
makes
do it.
sense. Definitely makes sense. You were
But I
selling.
think, I thought it was really exciting to bring this in, especially since we're focusing on infection control. I think that feedback now is a great way to really lower rates, and to maximize your workforce, to make sure that we clean better, clean more often. And like Delta Airlines, which I fly, used me to clean their planes and all their other passengers, this could be a great way to get the patient, and the patient's family without, telling them we want you to. I mean, they're going to be very happy to let you know what's going on and to make sure that that place is clean.
And
You
in
know what I was
fact,
thinking
got
about?
somebody to get to. They have somebody that they can talk to about whatever it is.
Exactly,
Detail.
exactly. I mean, since I just turned 25, the doctor insisted I get a colonoscopy. It's weird because they normally wait till you're 50. But at 25, they made me get one, and
Oh,
it was an experience. I won't share with you, Mike, but the
too. So
exactly. But I was going into the procedure, and there were a lot of things that which I recommend, by the way, everyone should get one. I'm not joking; it's a serious thing. But anyway, on that commercial break, including you, Sam, the on that commercial break, there you go.
oh,
I you
he's
know you there you go. If you go for this procedure or any procedure, one of the things that you feel or you're concerned about, take the word feel out. One of the things you're concerned about is that you don't want to be critical, because by being critical, you're very vulnerable. You're at the mercy of the nurses, you're at the mercy of the doctors, you're at the mercy of everyone there that is going to be doing procedures on your body when you're no longer conscious. If you have these devices, in strategic locations, maybe in the room before you go into the procedure, and you can alert someone that something is not clean. You press a red button and you let them know. It's another way of, first of all, telling the hospital staff that you're concerned, but more importantly, it's a way of the staff in the hospital letting you know, don't be scared, don't be afraid. We want to know when there's something wrong. So an operating room or a pre-operating room would be a great place to put those things, so that before you go in, when you're vulnerable, and just putting on that gown makes you feel very vulnerable. And so now you can press that red button and let someone know that something is not right in the facility that you're about to get your procedure in. So that's
Yeah,
something else I was thinking about.
I'll abstract it out of the colonoscopy example. I'll just say that, this actually came up with the behavioral psychologists because they were saying that one of the benefits of feedback now in the hospital environment is people, when they don't have control, seek control. It's kind of like the button that you press to cross the street faster, make the light change faster. Like when humans don't have control, they seek control for comfort. And
Right,
you are never, almost never in situations with less control, maybe jail, I don't know, than hospitals. So,
right.
and just having the control over your own experience, whether it's in a colonoscopy or just in the patient, like, yes, you're in a gap. You're at you can't go anywhere. It's a very vulnerable experience. So giving them this much control changes the experience, even if they never press it.
100%. 100%.
I could see that.
Listen, it's really a great product, a great program. Every hospital should have it. It really should, especially if hospitals that want to be, they want to be on the front line of knowing what's going on in their patient rooms, bathrooms, operating rooms, hallways. I think this is really a great opportunity to change the dynamic in healthcare. So especially when it comes to patient care and knowing what the patients are thinking and the families are thinking. So, Mike, you and I, we've had a lot of experience lately, the past couple of years, unfortunately, in hospitals, with relatives being in hospitals and family members. So we know exactly, what we're dealing with, and how this tool would be so great
Oh, absolutely. Yeah, there's no
in
question.
letting, imagine what we would have done with Tom and with your father, Frank. if these tools were available. You know, how much more powerful it would have been in getting help and getting response times. But anyway, I think we covered a lot here in the hour that we were on, and I think if anyone has any comments or any concerns or any input they would like to share with us, please let us know. Mike will leave the contact info at the end. And I think also Mike will put the Feedback Now contact info
Yeah,
at the end.
feedbacknow.com, right? Is that right? Is it feedbacknow.com? Yeah, go there
Yeah,
and I just
and
had a
check it
chance
out.
to go to it right before the meeting because I asked Renan who was going to be on, so I
There
only
you
had to
go.
see it for a second, but
I'm
yeah.
glad we prepare you for this, you know, Mike, you know.
So
We're very, very organized
feedbacknow.com.
here. Yeah.
Yeah.
Oh,
There you go.
thank you guys so much for having us on. It was a
Thank
blast to
you.
talk, and it's awesome what you guys are
And
doing. And like I said, continual listener here in
thank you very much. Thank you guys. And hopefully
Yeah.
we'll bring some more of this stuff to our customers and to our listeners. And looking forward to many more. And hopefully we'll have you guys on again, especially when new innovation comes out and new ideas come out. We'll be very happy to let the public know about it.
Are there
Anyway, yeah,
anybody on your site that talks about results or anything? Is there anybody that gives feedback on the website? I didn't get to see that or not, but
you can give us feedback right now.
no, but I mean, is there people on there? People went there and they wanted to listen to people, other hospitals that are using the system. Do you have that on there?
yeah, we
Yeah, we
have
have
that. We
case
have
studies.
videos.
Yeah.
Oh, good.
Yeah,
Okay, excellent. So
yeah.
everybody go see feedbacknow.com.
There you go. Thanks,
All right.
guys. Take care.
Have a good
Take
one.
care,
Thanks a
Mike.
bunch, everyone.
Speak soon. You got it. Take
Uh,
care. Bye.